Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Paul Pino, the co-founder and head of development and analytics at Integrated Home Care Services. How are you, Paul?
Hey, good. How are you? Thank you so much for having me, Jared.
Yeah, I'm excited to have you here. Plus or minus, 3. What do you think? I'm going to keep hitting my hat off this thing or what?
I don't know. It's funny. The other day I saw this video of this boom mic that just kept coming down on folks and knocking them over. It appears as though you're trying to do it to yourself today.
Yeah, I'm wondering with how much force do I have to hit this thing for me to fall out of my stool right now? But anyway, I will try to avoid that so we can have a great conversation here. Excited to
Or
have you on. Why don't we start off by you telling the audience a little bit about your background and we'll go from there.
Sure. So my background, I've always been in finance in one way or another. So I started in corporate and investment banking. Um, in 2006, I decided to co-invest with one of my clients that was in the home care space and really became very involved in managed care, not only from an ancillary home care standpoint, but also looking at primary care and full risk type models.
Interesting. And then that led you to co-founding IHCS. Can you?
Absolutely. So the original entity that I had invested in was taking risk on all home care facets. So when we define home care, we look at home health, home infusion, and durable medical equipment, and so all of the associated services there. So when you think through what we were doing back then was we were looking at home as being the optimal site of care, and we decided to put deep infrastructure around it. We were fortunate enough to sell that company back in 2012, and then we had an opportunity to re-enter the market right about November of 2015. And so our team got back together, and we were able to come back in the market. And so very fortunate to have been a part of a team that established this business, especially kind of coming into this pandemic and everything that's changed and all the associated volume of services going into the home.
And can you give us an overview for those that aren't totally familiar with IHCS? Kind of give us a breakdown of all facets of the business. Be much
Sure.
appreciated.
Sure. So IHCS is the largest independent integrated home care provider or service administrator for DME, home health, and home infusion. We have a national presence. Currently, we manage over 2.2 million lives under some sort of either delegated or capitated risk-based contract and scenario. Our services currently cover about 2 million home care units a month. Those are broken up amongst different lines of business. So we manage lives that are Medicaid or managed Medicaid. We manage lives in the Medicare Advantage arena and also in the commercial HMO arena. The types of services we provide, really, if you think about the enterprise, is we handle everything from personal care services. So think about folks that require facilities type of coverage, but don't have a facility type of acuity. So think about someone who needs help with cooking or cleaning or something else, but it's only slight help. And so these are things that someone would need to be able to just stay at home rather than live in an institutional based setting. We also handle very, very chronic oriented condition sets, patients that require ventilators, advanced therapies, and obviously, and some additional home infusion. So we grasp the spectrum of anyone that would require a level of convalescence that would normally be in an institutional based setting, but we provide those services so that patient can convalesce at home.
It's interesting what you've built so far and what you're continuing to just grow. Um, can you talk us through, I guess, how I know a big focus, obviously, you're in home care. How does ICHS define home care?
Yeah, so we define home care. So obviously, home care has been redefined over and over again, specifically post-pandemic, right? So the way that we define home care is, it's kind of that spectrum of services that include home nursing. So think about someone that would need a service such as physical therapy, occupational therapy, or speech therapy, or they would need a nurse to visit them for one reason or another. So someone's discharged from a hospital in a typical setting. They may have a wound, or they may have a surgery associated with some sort of fracture, and that person is going to require either some sort of post-discharge treatment for that wound, or in the case of a surgery, they may have required some sort of therapy in order to convalesce. Those services that are provided to that patient within the home setting, those are what we consider to be home care. Then, as I indicated earlier, those services tied with the personal care services that someone would need in order to be able to independently live at home. We would tie those together. And then lastly, any sort of equipment that a patient would need in order to be able to comfortably um, live within the home setting with a medical need. Those are also some additional home care items that we coordinate care around. So think about oxygen, ventilators, sleep-oriented equipment. Those items that you normally see around someone's house that's been sick or that has some sort of chronic condition set. We make sure that all those are coordinated and provided so that a patient could convalesce within their home setting.
You're involved with multiple aspects of the at-home care, which I think is much needed.
Mhm.
When we talk home care, what I always love doing with guests is I love asking them to predict the future
Right.
of different areas, right? So I'm going to ask you, what will the future of home care be? What will it look like?
So, we're very fortunate that from an entity standpoint, we get to coordinate home health, which is traditional nursing and therapy, DME, which is all durable medical equipment, and all the associated services, and also home infusion. And I think the future of home care, or the future of healthcare, let's start there, is pushing more and more services to the home setting. And so the future of home care is really partnering with entities such as IHCS that have the ability and the scale, the technology to be able to afford a patient the opportunity to convalesce at home with a significant level of quality, with a significant level of maturity, with a significant level of providing advanced information, data, and analytics to the payer resources. See, currently, what we do that really differentiates us beyond just the provision of high quality services is we coordinate the entire spectrum of care for home care services. So we partner with health plans, and then those health plans delegate network management and credentialing, utilization management, and claims payment and adjudication to us. So in essence, we put our arms around the entirety of that spectrum of care, which is typically fragmented and lacks coordination. And so, as a result of our ability to do that, we're able to control the patient experience, and we believe that the future of home care really is entities looking more and more like us that can become a single point of contact for a patient that requires this line of services. You know, over the course of the pandemic, right, we've seen this significant increases in the prevalence of homebound individuals, especially over the age of 70, right? It's gone from about 1.9 million seniors that were homebound over the age of 70 pre-pandemic to about 4.2 million now. We've also seen significant increases in the level of utilization associated with certain managed Medicaid oriented type of populations. So more and more people are seeing that they can receive care within the home setting. Fortunately, the pandemic did afford people the insight that these home care services were available, and that not everybody needed to present to the emergency room whenever they had a need, or they didn't also have to present or stay within an institutional type setting when they had a need for some sort of post acute type care.
Thank you for providing that. Both what the future will look like, and then giving us an additional background to I'm gonna mess this up. ICHS.
IHCS, but I'm not. I'm.
Oh, IHCS. Perfect.
You're welcome.
Jeez. That's why I'm supposed to say the whole thing, not the
You know,
acronym.
I should have worn an
Um,
IHCS hat so that we can match one another, and then it would have been
hey,
a lot easier.
that's why I do it, so people don't forget the name of the show. It's for the guests, not for me. No,
That's
I'm just
wonderful.
kidding. Um, well, can we talk a little bit about how you're, I guess, separating yourself, how you're differentiating yourself from the pack?
Sure. You know, there's the pack is always an interesting term, right? Because there are some folks that handle part of what we handle. There are some folks that handle things differently than the way that we handle them. I can tell you more about us and probably not as much about other folks. I mean, from our standpoint, um, as you indicated in the opening, I'm the head of development and analytics. And the rationale for combining those two functions is that we want our payer partners, we want our provider partners, and our patients to really know that we're looking at their lives objectively, that we're looking at all the information behind them, that we have absolutely every piece of information that's required in order for us to make sure that at every point in time we're doing anything that we can to make sure that that individual is receiving the most optimized quality of care. And so, from our standpoint, one thing that truly differentiates us is the fact that we literally work with all patient types, right? So if you see folks that traditionally work within the Medicare Advantage environment, that's one set of people. Other people work specifically within the managed Medicaid environment. And then there's other folks that focus on commercial type books of business. For us, a patient is a patient. Someone who is in need of a service within the home setting is the same. And I'd say that specifically for us, that is a key differentiator. We see all patients as having a need. We don't differentiate or segment patient types according to who it is that's ultimately reimbursing us. I would also say that a key component for us is that we truly understand the needs of our provider partners rather than having a kind of a global view. We have very much a specific view on our provider partners and what they need. We tend to partner in new markets with local and regional providers that have a solid footprint, solid capacity, great quality, but potentially don't have their name out there as someone that health plans are going to initially call. And so for us, building these relationships with these local and regional players is significant. And I'd say that's also a significant differentiator. We've also made significant investments in technology. Many of the folks that fall within the home care segment are really simply investing in technology just to increase reimbursement or to improve reimbursement. For us, all of our technology investments are improving the way that we not only handle the patient experience, but the way that we treat and work with our network participants and with our plan sponsors.
And as we wrap up here, Paul, I have to ask, what's next? What has you excited at the company?
So many things have me excited. So from a company standpoint, our continued national expansion, we continue to grow into new markets. The receptivity of our model really says a lot about what what the industry or what healthcare as a whole is doing for patients that have an inability to ambulate, right? And so, what we always need to realize is that if we're providing services for a patient within the home setting, 9 times out of 10, it's because that patient can't make it to an alternative type setting. Love to say that it's all about a patient, that where we're migrating all sorts of services to the home regardless of the patient's ability to ambulate. But really, what we're focusing on folks that have several chronic condition sets, right? So our typical utilizer of services, or of home care services, have over 5 associated chronic condition sets and multiple activities of daily living that they are unable to fulfill. And as a result of that, what we see a continued effort, a continued push, continued investment inside the home care environment. And so we're really excited about not only the fact that we're leading the pack, but also what the entire industry is doing for those folks that really don't have the ability to seek care outside of the home.
Well, Paul, I want to thank you again for joining me here on the podcast, and hopefully we can have you come on again soon. Give us an update on where the company is at, how the space is looking, and I know we'll see a lot of consolidation in this space and other spaces throughout healthcare. So maybe we can get your 2 cents on some acquisitions that'll end up happening in the space as well.
Absolutely, it's my absolute pleasure to speak with you. Thank you so much for the opportunity to share a little bit about home care and some about IHCS, and look forward to getting one of those slice of healthcare hats in the mail.
Everyone wants one, yeah. Just let me know. We'll start sending these things
All
out.
right, awesome. Well, listen, you have a wonderful day.